great thing about our job is we're a team. When you have good partners, it makes all the difference. Any day you go to work and you know that you're going to be able to impact someone's life, there's nothing better than that.
With the EMS, it's always been an industry of adaptation. You okay? Whatever the needs are of the community, we're first responders to adapt to, and every situation is different.
In Los Angeles County, we see a large number of patients, over 600,000 911 calls a year. And now the paramedics are empowered to provide the therapy that the patient needs.
Time is of the essence, especially with trauma-related wounds. So we're right on top of them with our medical equipment, and we can get them to a hospital very quickly.
Paramedics are the eyes and the hands of medicine in the out-of-hospital environment. They're there to extricate patients, they're there to manage disaster scenes, hazardous materials, deliver babies, and read an EKG. But most importantly, the paramedics deliver patients to the most appropriate facilities in order to save life and limb.
They're our first responders. They are the ones that bring the expertise of emergency medicine to the field. By having them start in the field, making good decisions, intervening with life-saving techniques and equipment right there at the time that the patient needs it, it's huge. I think it makes a difference every day.
USC base?
At USC base, rescue 25 of the medical run, severe distress.
Okay, go ahead, rescue 25.
Call to the home for a 95-year-old female, weighing approximately 110 pounds, altered level of consciousness, respiratory arrest.
Paramedic medicine has come a long way in the last 15, 20 years, certainly since the early days in the 60s. Now it's dramatically different. So paramedics basically can bring an emergency department to the field.
Yeah, renal failure, no?
When I first started, paramedics were treating chest pain and cardiac problems as just a broad scope.
You have any allergies and medications?
We could deal with blood pressure, we could give pain medication for that chest pain, but we had no idea the severity or if those symptoms are caused by something else. With the tools we have now, we bring the ER to that person's living room in a far greater way than we ever have before.
Back when I was a paramedic and a new MICN, we had to actually couldn't even start an IV without calling the base station.
I don't have a list, I don't have a chart. I have to create a chart. And that chart that you see in the hospital starts with us.
It's important not to be a robot. We have all these things in our mind and these skills we've learned, drugs we can use and things like that, but it's important to treat the patient, not the numbers. Treat the patient, build that bond, build that relationship, even if it's a 2-minute transport. Some of these patients are scared, or they don't know what's going on with them. They're nervous. They've never been in the back of an ambulance before.
No one's just not going to just pick up the phone and just call 911. They usually call when something really bad has happened.
You will let them know about the headache and you had some pain on your left side up here.
And I could definitely put myself in their shoes and what their thought process is.
Well, we ran a 12 lead and your heart looked okay. So they'll probably do some more tests at the hospital. Okay, sir?
And what I'm doing back there is I'm trying to alleviate some of that stress, some of that anxiety. I'm just trying to let them feel kind of at ease and that, hey, I'm here, I'm one of the paramedics, and I want to take good care of you. And you don't worry about a thing. We got you.
The exciting job of a paramedic to me is showing up and not knowing exactly what you're going into or what type of call you're getting. Here in Los Angeles County, we're fortunate to work in different areas that give you a variety of different types of calls. And it tests your paramedic skills in a lot of the different districts.
LA is one of the largest EMS systems in the United States and probably the world.
In air operations, we have the ability to send paramedics to the far ends of Los Angeles County and to cut down on time lost. My paramedics are put in positions that are truly dynamic. So we need to make sure that their skills are up. We need to make sure that they're highly trained and they're highly skilled professionals.
The paramedics in the Sheriff's Department are cross-trained in law enforcement and tactical activities such as SWAT, and they're also trained as a paramedic. So they play dual roles.
We're law enforcement, we're paramedics, and within that paramedic scope we also assist. We have maritime duties, assist our search and rescue teams. We also have the capability of transporting our SWAT team to outlying areas. If there's a hostage rescue, if there's a terrorist event, if there's an active shooter, we have the ability to really close that gap and take the proper resources there. We're a multi-mission, multi-function aircraft.
They're often there to support each other, be able to provide care to those who are part of the SWAT team. We have over 4,000 paramedics who practice in LA County. We're in charge of not only training paramedics, but also providing continuing education, quality improvement for the entire system, and oversight of all the critical care transports. Most are firefighters and EMTs first, and then once they reach that basic level of experience, then they go through over 1,000 hours of paramedic training.
They're our eyes, our ears, and our hands in the field, and so we want them to be able to look at a patient and recognize signs and symptoms that are really important. We get an incredible amount of information now before the patient arrives than we ever did in the past.
You had a seizure, okay? Take you to the hospital. Start an IV in your arm, okay? We do have a lot of autonomy in our position, but we're never alone. We know that we have the hospital support, and if we need them, they're just a phone call away, and so that's very important.
Recognizing things like mechanism of injury, subtle signs of internal injury. And so even though a patient may not look really sick when they first get there, they're trained to look at those signs and symptoms to really be able to intervene when something is overt. They have the tools, they have the expertise and the experience now to actually intervene in the field.
You know, tell me how old you are? What about your birthday? Can you tell me your birthday? 59? Can you tell me what city we're in? We've had to learn a lot about the different medications we use, the different technologies we use, and they take time to learn that, but all of them, once they're learned, become such a huge part of what we do. Now we can get a better synopsis of really what's going on, so we can give the hospital a clear and detailed picture of what's going on in the field, so they are better prepared for when we get there.
As medicine has changed, we have to be dynamic and we have to understand where it's headed and be able to provide those therapies for our patients.
All right, ma'am, take care of it.
We do that by understanding what our resources are, surveying our hospitals, seeing what kind of personnel and other technology resources we have available, and then we apply that within our system to give the greatest access to the public. The vision for the future is really a people-centered EMS system. The HEART program is essentially an example of mobile integrated health. They're able to not only provide care to the less critical and prevent 911 calls, but then have those resources available for those who really need it.
We have the capabilities of responding to medical emergencies. We're also considered an all-risk unit, so we can respond to pretty much any call for service that comes in if we're in the area. Our department did a 10-year sustainability study and found that by the year 2025, the community needs would outweigh our response capabilities. We'll talk talk to this guy real quick.
Anywhere that people like us have access to a shower?
Yeah.
Besides the multi-service center?
The village has showers.
Really?
Yep.
You happen to know their hours?
I happen to know their hours. We're directly addressing one of the issues that's at the forefront of the fire service, which is the impact of the 911 system as it relates to homelessness, and even with mental illness as well.
We see over 6,000 stroke patients in LA County every year. The mobile stroke unit is one of the first in the United States. We are bringing to the patient in the field the ability to do CT scanning if they've had a stroke with a large enough clot that they have injured a large portion of the brain. That can be removed, and a patient can go from basically not moving one side of the body to completely normal in an extremely short period of time.
Identifying stroke patients so that we can get them treated immediately is extremely important, and I think having paramedics that can do that in the field has made a huge difference in both outcome as far as people's ability to live normal lives and certainly survival.
On somebody's darkest day, we're able to give them a fighting chance. Having that opportunity to maybe change things or possibly change things or make it better is truly rewarding.
With the trauma he has, GCS.
That time factor becomes so important in many cases, and it allows us to hit the ground running.
What's your name? What's your name?
My role as a paramedic is to answer the call. As soon as the bells go off, I get to my patient as fast as I can, and I provide any sort of help or comfort.
Act with character, act with dignity, and be professional. Not just professional in our actions, but professional in our standards and how we treat patients and standard of care.